Welcome back to the Morning Blend. Did you know oral cancer is the 6th most common form of cancer? According to the Oral Cancer Foundation, more than 37,000 new cases will be diagnosed this year alone for the potentially deadly disease. Many of them will be men. So it's important to get screened, and you can do that with the help of our next guests. Here to tell us about the signs, symptoms, and treatment, Dr. Jay Davis and Bridget Fly with Boston Dental Group. Good morning and welcome back to both of you.
Morning.
Morning.
Thanks for having us back.
Yeah, our pleasure. This is such an important topic. What exactly is oral cancer?
Well, I think that's exactly what a lot of viewers are saying. Oral cancer, I haven't heard of that. You've heard of lung cancer, you've heard of breast cancer, colon cancer. Those are the big ones.
Yeah.
But oral cancer is out there. It's, like you said, over 37,000 people will die of this. If you want to relate that to where people can understand it, that's almost equal to the number of people that will die in traffic accidents in the year. It's prevalent. It's important that we get out there and tell people, hey, this is something that you might not have heard about. It's becoming really popular on the national stage now because of a famous actor, right? Michael Douglas, that was diagnosed with late-stage oral cancer. So it's important that we can talk about it.
And what are the causes of oral cancer?
Well, and that's where, you know, Michael Douglas was the poster child. In the past, we've always said, okay, it's an older, it's someone that smokes, possibly drinks. Those are classic examples. But now what we're seeing is, you know, from 1992 we've seen a decrease in the amount of oral cancer. But as of a few years ago, we've actually seen oral cancer start to rise again, and that's because we're seeing implications of HPV, or human papillomavirus. And right now, you know, is it older gentlemen? No, it's not. You know, right now, the studies have shown that roughly 1 in 2 sexually active adults in this country have HPV. So that puts not just older, you know, males that are drinking and smoking at risk, it puts females at risk and young people that are younger as well.
Okay, and we have some pictures that we want to show people of oral cancer, and the pictures may be a little bit graphic, but it's real, so we want to show it and let people know this is what can happen. So let's take a look at that while we talk. And can you tell us some of the warning signs that you may see?
Well, and this is where I want, you know, your listeners, your watchers to really write this down. I want you to write down 2 weeks. If you see a red patch, a white patch, any type of sore, you know, we've all got canker sores. We get these, what we would call a recurrent aphthous ulcer, with canker sore. Everyone gets those. But you know what, by day 8, day 9, they start to kind of go away. Yeah, they're painful, they hurt. But over 2 weeks, over 14 days, if you haven't, that hasn't resolved, that hasn't gone away, we need to talk about it. You need to go see your oral health care provider. And
if left undetected, what happens?
Well, that's where we go back to some staggering statistics of the oral cancer. Yeah, it's not as prevalent as the cancers we talked about before, but of those that get it, roughly 50% will die if it left untreated. But if we can detect it early, the survivability rate goes up dramatically. 80–90% is what we're seeing if it's detected early.
Again, that key is to find it
early
in
detection.
Early stages.
Early detection.
And that's where the screening is so important.
Absolutely.
Okay. And Bridget, let's talk about the screenings here and insurance. Does insurance cover usually that type of procedure?
Unfortunately, most insurance companies do not cover the oral cancer screening test. However, we do offer a complimentary benefits screening,
is it pretty simple? Just you book an appointment, you guys take care of the rest?
Yes, the procedure itself is fairly simple and it's painless. First, we will ask the patient to do a rinse with a solution for about a minute, and then the doctor will do a thorough examination with a light. If any abnormalities are detected, then the area will take a picture of that, and then it'll be evaluated by an oral surgeon.
Does it take just about 45 minutes to do, even less, or around there?
Even less, and that's, you know, we've seen this come to light on the national stage, but you know what, we're here in Las Vegas, and you know, your oral health care providers here in Las Vegas do a great job of screening. You probably don't even know it when you're in the office, but they're screening you for oral cancer. But what we're saying is, hey, there's other stuff out there, there's adjunctive procedures out there that can help us treat this and help us visualize it earlier.
Yeah, and that's the message you want to get out to people.
Absolutely.
Is to warn them and get this thing done. And let's talk about how many locations you guys have, because you have a lot out there, so it makes it easy for people to go see you.
Right. We have 10 Vegas Valley locations. Many of them are very nearby, so we have those listed.
Yeah, and let's talk again about the special.
We have a great special running right now. Typically, the oral cancer screening is $65, but for the Morning Blend viewers today, we are offering a complete exam, a full set of x-rays, and the Visalite oral cancer screening for only $19.99.
Wow, that is a good break. And doctor, again, if you feel like you want something checked out, it's very simple to do. It's to book the appointment.
Absolutely. Book the appointment. Come in. You know, you're going to have a lot of people say, well, the doctor is only there for a few minutes. Well, in that few minutes, we're trained for that. We go in, we look for suspicious lesions in your mouth, and like I said, oral cancer, treat it early. It's detectable. It's able to be treated, where you have a lot higher survivability rate.
Definitely. All right. Thank you so much for coming in this morning and shedding some light on this.
Thanks for not making us do the chicken dance.
Next time, okay? Again, if you call today and mention this segment when scheduling your appointment, Boston Dental Group is offering an exam, x-rays, and Visalite, oral cancer screening for only $19.99. For more information on Boston Dental Group, head to the website on your screen or call the number you see right there. And remember, you can see the segment again at vegasmorningblend.com.